Something we haven't hit on yet is asthma. That oftentimes asthma is related to damage or interference to the structural integrity of the spine and nervous system. The patients that I've treated that have had asthma, where it's been consistent throughout their lifetime, oftentimes it started shortly after a single traumatic event, whether it was a fall or an accident where they landed potentially on their head or neck. A couple patients I can think of in recent memory was that one of them fell out of a grocery cart and kind of plopped right out and landed on his head and neck. Another one that fell off of a wheelbarrow and just kind of toppled over. Mom saw him fall. She had more of a response, cried more than he did, so baby was, okay, so to speak. Within a month or two later, they start developing breathing problems. And we know from the innervation of the brain through the spinal cord that it goes directly to the lungs. So if it's compromised, then when we start fixing the problem and the proper nerve flow goes to the lungs, then we can support that. Now they also might have sensitivities to foods, sensitivities to gluten, corn, casein, soy, egg, yeast, and we can test for all these as well, and that's important. But we're going to look at the patient neurologically and metabolically. We're going to look at the nervous system, and we're going to look at the endocrine system, because we want to make sure that we address them as a complete person. And those are the two control systems, the nervous system and the endocrine system. So if you study it from a functional perspective, then you can treat them effectively. And if you look at the person just as a set of different organs or a set of different systems, but not as a functional whole, then you're going to miss out on some of that. So we want to look at the patient from a global perspective. We want to find out, we want to get a good history, do a good solid exam, and if we need to do any follow-up tests, if we need to order blood work, if we need to do imaging to find out what's going on, we have that availability. It's there. And I'm from Ohio, and we have great capacity to order blood work and do tests and send it away and have it shipped back within a week or a month, that they'll send it back to us and find out what's wrong with the patient. And that'll give us a great idea for a starting point for that individual patient, because every patient is different, as you know. And the patient's allowed to have more than one problem with them at the same time. That goes all the way back to school. Somebody gets in an accident and they have a contusion to a rib, their wrist, their knee. That's three separate things that need treatment or that need to heal. And just like somebody that walks in that has breathing difficulties, well, is it related to them working in a factory for years? Was there asbestos? Were they a smoker long term? Or has it been throughout their entire life? It started when they were young, and it was from unknown causes, and they're trying different medications. The best they're stuck with are these darn inhalers that they have to carry around with them forever, that they would love to get away from, that their parents would love to help them get away from, but they just can't because the symptoms are always present. And that's scary. You know as well as I do that when a friend, a loved one, you see them having trouble breathing, you just want to help them in any way you can. And that's why if you actually get to the root cause of the problem, which oftentimes is from compromise to the nervous system, meaning too much production or too little production, too much openness or too much constriction of the airways. Naturally for asthma, it's typically closed down. But this is what we're looking for, because the nervous system is controlling it, it's affecting it. If it's compromised, that will affect the production of the mucus in the lungs, the constriction of the airways, and that'll be a good clue to what's wrong with that patient.